welcome to the deep dive. We take source material, unpack it, and pull out the key takeaways for you.
And today we're diving into something very specific, a medical document.
That's right. Our source is a discharge protocol. It's written by Dr. Gregory Weir for his patients, specifically those at Life Eugene Moraes Hospital, recovering from Endovascular Aorta Aneurysm Repair, or EVAR.
And we absolutely have to start with the disclaimer included in the document itself. It says, and I quote, "This is a discharge protocol written by Dr. Gregory Weir for patients managed by him at his practice at the Life Eugene Moraes Hospital. The contents should be discussed with your own doctor and should not be considered as advice if you are not a patient of Dr. Weir."
Right. Crucial point. So our job today is just to unpack this specific protocol based only on what's written here. We want to highlight the main steps, the advice for recovery, the long-term stuff, just to understand what these particular instructions involve.
Okay, let's get into it. The protocol kicks off with the immediate post-op period. We're talking the first 2 weeks after the EVAR procedure.
And there's one rule that just leaps off the page immediately. It's in bold. Do not sit in an upright position for 2 whole weeks.
That sounds, well, really difficult. Why such a strict rule? What's the thinking there, based on the document?
Well, reading between the lines of the protocol, it seems laser-focused on protecting the actual repair site. You know, the EVAR procedure involves getting access usually through the groin area.
Right.
To put in that stent graft, sitting fully upright makes a sharp angle at the hip and groin.
Ah.
And that bending could put stress potentially on those access points, or maybe even where the graft is sitting inside the aorta.
So it's all about preventing that bend from causing problems with the new repair.
Exactly. The protocol does allow a tiny bit of leeway. It says you can sit, but only in a sort of 45-degree slouch.
45 degrees.
Yeah, and get this only for 5 minutes at a time.
5 minutes.
And only every 4 to 6 hours. That really tells you how much they want to limit that angle. Wow, 5 minutes every 4 hours or so.
Yeah.
That really drives home how serious that restriction is. It makes you wonder how you'd even, manage meals or anything. And linked to that hip bend thing, it also says no driving, right? And if you're a passenger, keep your legs as straight as you can.
Correct. It all points back to the same goal, keeping that groin, hip, wound area from bending more than that 45-degree mark. Minimize any strain on the fresh surgical site.
So based on this document, those first 2 weeks are pretty much spent lying down.
Seems like it. And besides the movement rules, rest is obviously emphasized. Avoid strenuous physical activity completely for those first 2 weeks.
Is there anything specific about how to rest? Like positioning?
Yes, it mentions elevating your legs. Keep them higher than your heart when you're lying down.
Okay.
The protocol says this helps reduce swelling, which, is pretty common after these kinds of procedures. Helps with comfort, maybe healing too.
Right. So moving on from rest and movement.
Yeah.
What about basic needs? Like fluid?
Hydration gets a specific mention. The protocol is quite clear that getting enough fluids is crucial.
And it links hydration to reducing complications and helping with constipation.
That's right. Avoiding constipation is definitely one benefit mentioned. But good hydration also helps, maintain good blood flow and volume, which you definitely want after a vascular procedure like this. Helps healing, might reduce clot risk around the graft. Supports the whole system, really.
Yeah, that makes a lot of sense. Okay, now, wound care. This section had some really striking, very specific instructions, like absolutely no showering or bathing for the first 2 weeks. Why so strict?
It seems pretty clear the concern is infection. Those access points, often in the groin, they're basically direct routes into the vascular system where that expensive graft is.
Right.
An infection there could be really, really serious, could even involve the graft itself. So keeping those wounds completely dry and clean is a top priority, according to this document.
Wow, okay. Linking it to graft infection really explains the extreme caution. It allows a bird bath or a sponge bath.
Yeah.
But you had to be super careful not to get the wounds wet at all.
Correct. And it details keeping the wound covered with a waterproof dressing. It even names an example, Mepilex Border AG. That level of detail is interesting.
And you change that dressing every 3 to 5 days after cleaning the wound. What does it say to clean with?
The options given are Prontosan or sterile saline solution. Very specific.
And what if? What if the dressing gets soaked through, like much faster than 335 days? That sounds like it might be a problem.
It's definitely flagged as something important. The protocol says if the dressing gets saturated sooner, you need to change it, and this is key. Phone the consulting rooms immediately.
Okay.
It implies it's not just a simple dressing change. It needs medical attention or at least assessment.
That makes sense. Vigilance is key. What about medications? Obviously vital after surgery.
The main rule is just strict adherence. Take what's prescribed exactly as prescribed. It mentions some common combinations you might expect.
Like an antiplatelet, aspirin maybe, often with clopidogrel.
Yep, that combination is mentioned. And it also notes that if someone was already on an anticoagulant, something like warfarin or rivaroxaban before the procedure, they usually just continue with that afterwards.
Okay. And these drugs, the antiplatelets and anticoagulants, they're all about preventing clots, right? Especially around the new graft.
Exactly. They work slightly differently. Antiplatelets stop platelets sticking together. Anticoagulants affect clotting factors, but the goal is the same. Keep blood flowing smoothly, reduce the risk of clots forming on or near the graft. Super important for it to work long term.
Got it. And the protocol also says basically keep taking your other regular meds for blood pressure, diabetes, cholesterol, all that.
Yes, continue all chronic medications. And it mentions Movicol for constipation.
Ah, yes, Movicol.
And smartly ties it back to hydration, reminding you to drink plenty of fluids to help manage or prevent constipation. And again, if constipation gets severe, contact the rooms.
Right. This leads nicely into a really critical section for safety, recognizing potential emergencies. What does the protocol tell patients to look out for?
The general advice is pretty broad. Contact the rooms if you have any issues with your legs, your wounds, or notice any other sudden changes. Don't wait.
Okay, any is pretty comprehensive, but is there a list of specific things that need immediate contact? Things that scream, call right now?
Yes, there is. And you're right, this list feels crucial. It includes sudden onset of pain, swelling, losing sensation, weakness, any discoloration, bleeding, or, again, any other sudden change.
That covers a lot of ground changes in feeling, appearance, pain.
Pretty much anything that feels suddenly wrong in that area or the legs. These could all be signs of problems with blood flow, the graft, or the wound site.
And the final bit of advice in that section is just so direct. Remember, when in doubt, phone the consulting rooms.
Can't get much clearer than that. It really emphasizes patient vigilance and leaning on the medical team if anything seems off. Better safe than sorry.
Definitely. So after this intense 2-week period, what's the plan for follow-up, according to this document?
It's straightforward. Follow-up appointment at the consulting rooms. It says this should be prearranged and happen within 2 weeks after the procedure.
Okay, so a check-in relatively quickly.
Yeah, presumably to check the wounds, see how recovery's starting, that kind of thing.
And looking beyond those first couple of weeks, the protocol shifts gear a bit towards longer-term health, right?
Right.
How does it guide people back towards, well, normal life while staying healthy?
It talks about gradually increasing daily activities first, not jumping straight back into intense stuff. And it actually recommends specific exercises.
Ah, yes, I saw that. Walking, cycling, and swimming are the ones listed. Why those particular ones, did it say?
Yeah, the protocol notes they help strengthen the calf muscles and improve circulation. That calf muscle pump is pretty important for helping blood get back up from the legs.
Right, the calf pump. So it's targeted exercise to support the vascular system. Makes sense. And when can someone expect to resume a full exercise routine?
After 6 weeks, according to this document. That's the timeline given for resuming a full exercise program.
Okay. And beside exercise, it flags a couple of other long-term essentials. Weight control.
Yes. Long-term weight control is stated as essential.
And the big one, smoking.
Absolutely essential is the phrase used. Smoking cessation is heavily emphasized.
It goes further than just saying stop smoking, though.
Yeah.
It actually suggests specific medications if just trying to quit doesn't work. Varenicline or bupropion.
It does mention those, yes. They're prescription meds that can help with quitting smoking by targeting cravings and withdrawal.
Okay.
The fact that it names specific drugs and says to contact the rooms if conservative measures fail, well, it shows how seriously this protocol views stopping smoking. It's not just lifestyle advice, it's framed as a critical part of the medical management after EVAR.
So wrapping this up, diving into this specific Dr. Weir protocol, we've traced a path from those incredibly strict initial rules. You know, the no upright sitting, the intense wound care through managing meds, knowing emergency signs, the follow-up check, all the way to building long-term habits like specific exercises, weight control, and that really strong push for smoking cessation.
That's a good summary. This document lays out a very detailed plan for Dr. Weir's EVR patients. It underscores that recovery isn't passive. It requires strict adherence, constant vigilance from the patient, and clear communication with the medical team according to these instructions.
It really makes you think, doesn't it? When you see this level of detail tracking how wet a dressing is, knowing exactly which leg symptom needs an immediate call, how does understanding these precise steps maybe shift your perspective on post-surgical recovery? It's clearly presented here as much more than just resting. It's active, informed self-care guided by very specific rules.
Definitely food for thought. And just to reiterate one last time, our entire discussion today was based solely on the content of this specific discharge protocol provided to us, the one written by Dr. Weir for his patients, as highlighted by that disclaimer right at the start.